So step 5 is doing it all by yourself. So another problem is practices that think, okay, I can do this, everything's going to be fine. You know, the reality is you are competing against larger practices or corporates that have got reality much bigger marketing budgets and bigger teams than the majority of practices out there. True? Okay. The other problem is that your patients are being, as we've talked about, are being bombarded with these messages. Okay? They're being bombarded with messages from the bigger dental practices, but they're also being bombarded with, you know, the apples of this land. Okay? Everybody's competing against the same dollar. True? If your patients have the choice to get the implant or to go on the cruise or to buy the latest iPhone, you know, like it or not, marketing is a discretionary spend. So when you're thinking about your marketing, you need to really think seriously about the noise and the competition and who else is trying to get their marketing message through, to get the dollar of your patient. You know, patients are expecting more. Once upon a time, it used to be okay to have DIY marketing, but because of the saturation of the messages that are out there, public's perception of what marketing should be and how it should be presented has changed. My favourite slide of all time, and I'm hoping, and one of these days, somebody will go, that's my logo. Okay, I'm hoping it isn't today, okay? It used to be okay to have a logo that was a piece of clip art with some words associated with it, okay? It's not okay anymore. It used to be okay for you to have professionally made up logos and then for you to put something together in Word and print it out on your printer in the practice office, okay? Does anybody know why it's not okay anymore? Because of these guys, okay? Who here has got the marketing budget with Maven? Because I'd love to talk to you later, okay? You know? Nobody. Who has a marketing budget of Bupa? Bupa and Coca-Cola probably, but that's about it. All right? Your patients, like it or not, and we can have a whole conversation with more cake and more caffeine later, your patients are going to judge your clinical skills on this. Okay? What do you think an average patient will think this compared to this? Okay? You know, and I know, that there's probably going to be a whole ton of difference in the clinical skills, but it's not the way that's presented here. True? Okay? The public, on the whole, will think beautiful marketing, great dentistry. True? I know it's not okay, I know it's not fair, but that's the reality. Okay? You've got to look professional. Whatever you do needs to look on par with the big guys in town, because they are competing, because they are opening up around the corner and across the street. You've got to be consistent, you've got to be professional, because your brand will be damaged as a consequence. You know, and it doesn't need to cost Bupa prices. This is a practice in country New South Wales. Existing practice, they needed to be rebranded. They needed to have a brand that brought them up to the here and now. Okay? You know, it looks good. It looks professional. It looks slick. Okay? Brand guidelines. You need to Know your colours. You need to know the fonts. You can give that to any dental or any marketing company ever. If you've got the guidelines, you can say, look, this is what my branding has to look like. This is what my colours are. This is what my fonts are. You can have that consistency. This is how the big guys do it. They have the document that they can then pass on to make sure that everything looks the same. You know, no more happy smiles. No more clip out. Okay? No more websites that were made by your cousin's nephew for his HSC project. Okay? Don't get your practice manager, don't get your receptionist to create something that's good enough in Word. Okay? No more different colours, no more different fonts, okay? Just try and make it look professional. You know, do not steal, okay? Don't steal other people's content. Don't steal other people's images. Don't steal other people's ideas. I know you're time poor. I know budgets are tight. Okay? But just make the effort to make sure that everything that leaves your practice represents you, reflects you, and is something that you're proud of. Okay? It's better to have something that is well done and done once, as opposed to something that is being just shoved out there consistently. So make sure that you are getting the right people to do the right job. Okay? So if you want a website, make sure it's built by somebody that actually is credible. Now, classic example are the people that say, okay, I'll get a website done overseas because it's cheaper. Exact examples before, and the business goes out of business or the developer disappears. Yeah, and you can't change it, and you're left with this thing. You've paid a significant amount of money, and you probably spent a huge amount of heartache and effort getting live that you're then stuck with, and you can't change, and you don't know what to do. Okay? Make sure that you're getting the right people that you know are going to be there in a year's time when you need to make the changes. Now make sure that you're consistent. It's just little things. Same font, same colour, same images. I was just saying that we offer a service that looks at a practice, their marketing, where they are, and one of the things is, you know, looking at the branding consistency and how it's looking. And you know, so many practices have a sign that's one colour and a website that's another, and reception area, and it just jars. You know, don't take the shortcuts. Make sure that you're doing things well.